Hi there, welcome to Ask the Chiropractor, your source for ultimate health, healing, and chiropractic related information. I'm Dr. Adam Rodnick out of Commerce Township, Michigan. We're here with our returning guest, Dr. Corey Baltazar, out of Northville,
Thanks
Michigan.
for having me again.
Absolutely. So I'd like to start talking about, this is a question I hear from friends of our patients or people that they know, maybe acquaintances. They say, you know, I hear that so-and-so's kid goes to the chiropractor all the time, a couple days a week. Can't all that crunching and cracking on their spine be bad for them over time? And kind of goes back to that old wives' tale, you know, can cracking someone's knuckles cause arthritis?
Exactly, and my response is always, we need movement in the spine to fully function, you know, and make sure that, and as chiropractors, we're not just going in there and, you know, adjusting the spine just haphazardly and, you know, just, you know, cracking people's backs to get noise. We're actually detecting areas that aren't moving properly, or there's muscle spasms surrounding the joints that, you know, that we detect, you know, subluxation and some nerve irritation. Just because the patient is not symptomatic does not mean that their spine doesn't need to be adjusted. And that's the biggest misconception. A lady came in the other day and she brings her kids and she says, you know, she kept telling her kids, even though you're healthy, you still need to get your spine checked. Meanwhile, you know, on the intake form, her daughter fills out that she gets stomach aches all the time, and headaches and little things that most people think, oh, everybody gets. Well, no, if you're healthy and you have no interference within your body, you shouldn't be getting, you know, headaches or migraines or, you know, gastrointestinal.
And pain doesn't just equate to health.
Exactly.
You know, someone may have almost no symptoms and not be healthy, or they could have, you know, organs malfunctioning and have some of those type of symptoms but no pain. Pain doesn't equal health. Someone could feel good and be sick and unhealthy. Someone could feel bad, and there's a reason for it. They're a professional athlete. Well, of course they're going to have some pain because they're wrecking their body all the time. So a lot of people think pain is sickness, no pain is health, and that's not the case at all. So going back to what we said with, you know, someone cracking their knuckles causing arthritis, again, what it is, if we open the joint space, there's depressurization of the gas. Motion is great for all joints. That old wives' tale comes from because people can crank on it and twist and do their knuckles the wrong way. And of course, if someone's grinding on their spine or their joints, that can cause wear and tear over time. But the way we do it as a chiropractor, properly realigning the spine, breaking up areas of adhesion, breaking up places where it's not moving correctly and there's abnormal, aberrant motion, is absolutely great for the spine. And so that misconception, you know, some people say, well, so-and-so's kid goes there all the time, it's got to be bad. Well, would it be bad for their kid to work out and go to the gym every day? No, the more they do it, the better it is for their spine. And a similar thing, the more they do that, the better it is for their muscles. Similar with the spine, the more often people get adjusted, it can be great for their spine. Normal, healthy motion is always going to be good for the spine.
You know, wellness care is something I always preach in my office. It's, you know, it's the once a week adjustment. If, you know, scar tissue layers in every 7 to 10 days. So why shouldn't we get the spine checked?
For everybody,
every person
should get adjusted.
It doesn't matter if it's a 1 day old that was injured at birth, or a you know, 60-year-old that comes in and they have tons of degeneration or arthritis in their spine.
It's like saying, why should people brush their teeth every day? Well, because you want to keep them clean. And why should people keep looking at their spine and keeping it healthy and keeping it moving? Because it's good for them. Just like brushing their teeth every day is good for their teeth, getting chiropractic checkups is great for the spine.
Exactly. You know, I always tell people, you know, if you go to Disney World, do you see trash everywhere? And they have a whole underground trash system there. And it reminds me of the phrase,
I didn't know that.
Dr.
That's pretty cool.
Yeah. And so you never see whole lot of trash. And even if they do have a big parade or something, they come in and they clean up all the trash right away. And they don't allow, you know, could you imagine if they left trash everywhere from that many people being there? There would be vultures, there would be rats everywhere. But because they're so prompt on getting that cleaned up, they don't allow it to get out of hand. And that's what most people do, is they wait for that pain to come, or they wait for that dysfunction to their nervous system to come, whether it's a digestive problem, a headache, or you know, a heart problem, heart condition, or a lung problem, to actually take care of it. And then in the meantime, they've found that, you know, they go to you know, they go somewhere and to a doctor and they say, this is my symptoms. They get a pill for it. The pill actually changes the physiology of the body to override their body's telling them that something is wrong with the actual organ or the dysfunction of the actual spine.
And like you said, symptoms are often the tip of the iceberg.
Exactly.
Underneath there's a lot more, and a lot of times symptoms are one of the last things to show up once there's been a problem or dysfunction of the body. Symptoms don't usually show up right away. That's why they have the term, the straw that broke the camel's back. So much has been put on it until one little bit more causes now a symptom arises. And so fortunately and unfortunately for people, symptoms are one of the latest things to show up. Fortunately that they didn't feel bad, but unfortunately that they may not have realized that they have a problem. And fortunately and unfortunately for them as well, symptoms are usually the first thing to go away once we start to work on them as a chiropractor. So fortunately, they feel better quickly.
Yes.
Unfortunately, they don't realize often that their problem isn't gone. They just feel better, and so they need a lot more work. So people don't really understand that. A lot of times people may go to a chiropractor once or twice, wow, I feel great, and then what? They stop coming.
They stop coming, and what happens is, that scar tissue still layers into the joint because it's not healed properly. 12 to 16 weeks for a joint to fully heal. So, why are you going to stop it after a month of care? And right. I always remind people, you always want to clean windows, and that's big. Dr. Ryan's in our office is, you always want to get them to want to clean windows. You don't want to be constantly wiping dirty ones when they leave your office in a month's time and they're back for the same exact problem. Okay, so you never want to see people coming in with the same exact problem every single visit, because for one, it's exhausting as a chiropractor to constantly be educating them on why it's important for wellness care. Do you go to the gym every day? Do you drink purified water? Do you eat organic foods? Do you use air purifiers in your house? Do you stay away from poisons and toxins? Those are all things that need to be utilized to maintain a healthy lifestyle and a wellness type lifestyle. It's not a one day or one time thing that yes, sometimes one adjustment can get you out of pain.
Miraculous. Yeah,
oh, awesome! I haven't felt this good since I can last remember. Well, that's great, but hey, we still got to heal your spine.
And is that good for them to have that? Absolutely. And
Exactly.
Do we have some patients that do that? Absolutely. And if that's what they want and they understand it, I always want to support them in that if that's what they want. But I always want them to understand how much more they could get if they were able to get farther to the root of the problem and break up some of that scar tissue and adhesion, make more changes in the structure and the function of the spine and the nervous system as well.
And as chiropractors, when we re-x-ray in a year, we can see those physical changes. The disc spaces increase, the joint alignment improve. Sometimes you can't go and make a lot of with the bony the changes in the spine, but I mean, if the joints aren't moving properly, the discs are going to degenerate. That's why every single person should be a chiropractic patient. And if you don't brush your teeth, what do? They rot. So if the spine's not moving properly, it rots. I mean, it's not rocket science, people.
So what we're showing here, this is two different discs. The spinal or the intervertebral discs are the shock absorber between the vertebrae. They function, they're kind of like a sponge. You take a wet sponge, you could stomp on it, squish it, run over the car, it's going to poof back up. But if you take a dried out, wrinkled up sponge and run over it, it's going to crack, it's going to wrinkle, it's going to break. Same thing here. The discs get good things in, like water and minerals and nutrients. They get bad things out, like scar tissue, inflammation, cellular debris, through proper healthy motion. They get locked up, starts to be like that sponge drying up. You see that now the disc space has started to diminish. The body then recognizes instability around the joint and produces extra bone growth or calcium deposits, which we call bone spurs. And when we see bone spurs in an x-ray, that's our first sign that someone has arthritis. Arthritis is a big buzzword. A lot of people hear of arthritis, they think it's something you caught arthritis or you got arthritis or everybody gets it when they're old. Now there's two types, rheumatoid, which is more chemical, and osteoarthritis, which is what we're talking about right now. Degenerative osteoarthritis is wear and tear. Now I take x-rays on people all the time and we'll take a look and they'll say, well, I'm getting old, doc, I should have some arthritis. Well, why would they have it in one area but not another? Or down here but not up here? Because that's where they've had the most misalignment over time. Where they have the most misalignment over time, they get the most degeneration or wear and tear over time. If this one's twisted way out of place, well, of course, that's going to wear faster. Like a car that's out of alignment. The more you
Exactly.
drive it, the faster it's going to wear, and it's going to wear unevenly. Tires are going to ball, parts are going to wear out faster.
And people oftentimes come in and say, well, you know, I've tried physical therapy and that didn't work. And I say, well, you know, you can't put, you know, I said, what do you do for physical therapy? Well, you know, they did some passive, you know, what they consider passive therapies or muscle stimulation and reduce, you know, the inflammation around the spine or around whatever joint they're trying to heal. And what happens is they start doing exercises. Okay, they're strengthening around a misaligned joint. Okay, you can't put brand new tires on a bent frame of a car, you know, a car that has a bent frame, and expect it to ride like a brand new car again. You have to realign the car. Why do they do an alignment when they sell you new tires? Why do they encourage you to get an alignment?
Right, and you still do want to put the new tires on at some point, and that's why
Exactly.
we can work very well with physical therapists. A lot of times,
Yes.
That's a misconception.
Exactly.
That, you know, someone's doctor may say, you know, oh, do the therapy first, and then go to the chiropractor. Or do the chiropractor first, then go to therapy.
You can do it simultaneously.
You can do it at the same time. And some chiropractors or physical therapists may say that, oh, I want to see the progress we're receiving here, and then go there. But me personally, I'm for whatever's best for the patient, and I would rather. I don't care if I take the credit or they take the credit, as long as we're both being able to help them at the same time. So
exactly. In the end, it's their body healing itself.
Exactly.
So
exactly.
No one should be taking credit. They should be you know, it should be a medical team, and that's, you know, whatever's best for the patient. You know, when it gets to a point where when someone, you know, they have, you know, this degeneration leads to, you know, basically a crippled spine, that nerve function, they're in constant pain and there's constant irritation, bone spurs. A surgeon is needed, you know,
Yeah.
and some chiropractors will say, well, why would you send a patient because I want what's best for the patient. So, you know, you don't want that that misconception of that, you know, a chiropractor thinks he can heal anything. No, if there's limitations that matter, I can't heal everything.
No, and
you know, I can't help your body heal everything.
Still good for that person at the time, but obviously
Exactly.
it's not going to heal everything. We're not going to take an X-ray and all of a sudden all those spurs are just going to be gone and their disc spaces are going to be just like new again. Obviously, they have some serious, permanent, irreversible damage. If we would have caught that person 25 years earlier, could we have helped them more?
Oh, absolutely.
And that's why I'm a big advocate of prevention rather than waiting until it's too bad, where they, you know, we can still help them, but not nearly as much. And a lot of times that person, we can help them a lot with their symptoms, but structurally, it may be shot. You know,
Exactly.
there's not that much we can do with them structurally as well.
And that's why I tell. I got a guy right now. You know, he's to the point where he needs some surgery on his neck, constant pain down his arms, and just can't live with the pain. And I said, well, you know, he's seen such improvement with his low back. I said, let's prevent that from happening to your low back.
Absolutely.
Let's take action on your low back, because it's not to the point where you need surgery yet.
And it's probably not too far behind.
Yeah,
right.
exactly. And let's keep the areas that aren't even if you get a fusion, I said we can still keep the areas moving around that surgery to prevent them from becoming hypermobile.
And that's a misconception I'll hear from patients. They'll say, oh, you know, now I may have had a surgery, I can never have chiropractic care. And that's not the case at all. Let's say you surgically fused with a metal plate, some screws in here, or cadaver bone between two of them. Well, now a lot of that pressure is going to be taken right above and right below, segments that we still can adjust and keep motion in as a chiropractor. So those are going to take the next round of the heat. So a lot of times we see people that have had surgery, the next thing you know, they have to have one above, another one below. And so even after that, if we can stay ahead of it, that's great for the patient.
Exactly. Patients that have, that is a big thing. Is people automatically assume, I've had surgery. It's a fear thing too. They think, well, you can't touch that area. Well, it's stabilized. I can't go and adjust that area.
Open, right?
There's metal in there. I can't go in and do anything about it. But let's be proactive about the rest of your spine. Why would you want to have two surgeries when you could have, been proactive?
And unfortunately, a lot of times people that think once they have a surgery, they're going to be good as new. And unfortunately, especially with the spine, that's not the case. Some joints, perhaps the spine, most of the time, is not the case. Sure, they can take a disc out, and they may not have irritation down their arms because they took some of the pressure off the nerve, But more of the time, we see patients that have had a surgery that still have pain.
Yeah.
You know, still have
Discomfort.
a lot of pain.
Yes.
So yeah, so we still can work with them. Now, what would you say? When is the earliest that the people should get checked?
Right after birth. You know, in the office we just had Dr. Ryan just saw a 2-day-old, and they went from basically the hospital to the office and got the baby checked. And you know, it's so much easier. People don't realize it's so much easier to adjust a baby when they're you know, when the misalignment or the subluxation is so new and fresh versus waiting till a couple layers of scar tissue. I've had people, you know, they wait 3 weeks or 3 months to get their baby in, and I say, we had this discussion when you were pregnant, and you understand how the body works and how, you know, the birthing process is so traumatic and so you know, and can be so detrimental to someone's health. There's really, you know, I'm sure when you had your daughter, yeah, when you're gonna adjust your daughter right after the birth. Okay.
Absolutely.
Yeah. Come to daddy, and guess what? She's gonna get adjusted, and it's just your natural ability to know that that's what's best for her. You know that it's such a traumatic process that, you know that if that nervous system's irritated at all, it's going to create just problems down the road, whether it's, you know, latching or, you know, any type of breastfeeding issue or digestive or, you know, irritable baby type issue. So
we have a little video clip, a prominent pediatric chiropractor, and she'll talk a little bit about pediatric chiropractic and babies getting adjusted, and we'll come back in just a minute.
Labor and delivery is a marathon for the mother and the baby as well. There's an enormous amount of stress put on the baby's musculoskeletal system during even a normal birth process. But very often there are interventions done in the birth process, like vacuum extraction or induction, or of course C-section. As chiropractors, we understand that they put extra stress on the baby's gentle musculoskeletal system. We very gently examine babies for restrictions in range of motion and imbalances in the musculoskeletal system. And with just a very gentle touch, we're able to adjust the baby and restore the normal function of the joints and the surrounding muscles. Babies are young and they don't have very long-standing patterns in their bodies. So checking a baby soon after it's born could go a long way to just eliminating these patterns in their body forever. The work we do on babies is gentle. We usually keep babies dressed. Often they're lying on the chiropractic table on their back, sometimes on their tummy. Sometimes we'll even have them lie on their mom or have their mother hold the baby, or we'll hold the baby while we gently examine or adjust the spine. The work we do on babies is gentle, and babies usually like it. It's not painful to them at all, and they get very relaxed. Some babies even fall asleep. Parents report that their babies sleep much more deeply. They'll sleep for longer periods of time. It is very helpful with nursing problems, either babies that are having trouble latching on, or babies that have a very weak latch, or babies having trouble nursing on one side or the other. That's why so many lactation consultants refer their new babies to me when they're having difficulties nursing. Mothers also report that after chiropractic care, their digestive systems become more normal. We see less reflux, less constipation, and many mothers report that when their children are under regular chiropractic care, they have less colds and ear infections as well.
It was really great and articulate the way she explained it. Most people would never think that a baby should see a chiropractor. They say they're fresh, they're just born, why would a baby see a chiropractor? It's important to start them off right, to start them with a healthy spine, keep it as healthy as possible, because they can have a lot of trauma during the birth process, and even before that. If the woman has a retroverted uterus, if there's twins, triplets, obviously there's not much room in the uterus, so the spine can even develop improperly to start with as well. And so let's talk a little bit about what it looks like when we adjust a baby or when a baby is born, what it can do to the spine.
All right, so you know, a lot of times we use the reflexes of the baby. People don't realize that, you know, there's primitive reflexes. Primitive means that they're inborn into the baby to know, okay, when if you just touch their cheek, they'll turn towards it in order to find the nipple and
If
feed.
there's a nipple, they suck.
Yeah, exactly.
These are
And then,
reflexes.
you know, in utero, they have their thumb in their mouth to strengthen up their sucking, the muscles that they're going to be able to suck with in their mouth, and that's, you know, that's why you see baby with the thumb in the mouth, and these are all inborn, you know, the innate intelligence of the body, which is our inborn ability to survive. Okay, and we were talking about that last episode, but when we can check. Okay, so anytime that the foot, if we hang a baby upside down, and most parents kind of look at me like, you're crazy, put my kid down. You can hang your kids like this, okay? They're used to being upside down if they're not breached for quite a few months. So it feels good for them, actually. It stretches their spine out a little bit. And what I do is I just release one of the legs, and they would naturally turn their head towards that side. If they can't, they feel stuck, then you know that the upper neck needs to be adjusted on that side, okay? So, and then you check the other side, the baby turns head. So what happens is typically the most common area that we're going to find subluxation right after birth is the upper head and neck due to the birth process. 120 pounds of pull out of the, you know, and people say, well, my kid was a C-section baby. I say, well, you need 200 pounds of pull, so it's even worse, or 220 pounds of pull. So those are things that, you know, I see more problems occurring in, you know, you're going against the natural musculature of the mom in order for the birthing process to happen. You're going against all that when you have a C-section birth, and I'm seeing way too many of them because it's convenient. It's convenient for the doctors. You know, it's a convenience thing. We're turning it into not what's healthy for the mom and the baby, but what's convenient. If there's any struggle, not, hey, let's try to turn the baby, or, you know, use chiropractic, different techniques to release out the uterus and get things moving.
Now, in general, too, the bones in a baby or even in a child are much softer than adults. So they can absorb a lot more of the blows, but even if you think of after their babies, all the things that kids do, they can't absorb all of these blows. And that's why, you know, baby's skull is so soft, because the skull has to move and manipulate to even get out of the womb. So they can absorb some of these blows, but we really are putting a lot of pressure automatically just for the baby to come out. Even if there's no help, there's still a lot of pressure just squeezing the head and neck as the baby comes out, and can cause teeny tiny little misalignments, just millimeters, ever so slightly in that upper cervical area. And so some of the symptoms that sometimes babies can have, things like infantile colic or ear infections, breathing problems, things like that as well, that we actually have some really great results with babies in our office with things like that.
Oh, absolutely. And sometimes I'll even get moms that'll bring the babies in, and they'll say, you know, chronic ear infections, and I'll say, is it right ear always correct? And they go, how'd you know? And I say, well, the upper neck is, you know, shifted to the right, and the draining of those eustachian tubes is inhibited because of the alignment. Imagine if your head was tilted all the time like this. Obviously, you know, you make the correction, but if your head's tilted like this, can you get proper drainage of that eustachian tube? No. So they develop at a different, you know, those eustachian tubes develop at a different, you know, as the skull grows, they grow deeper, so at a greater angle. So that's why adults typically don't get ear infections.
And even so, the nerves that control the eustachian tubes, and even the lymphatic drainage, just from having baby has torticollis, they have tight musculature in their neck, or even not torticollis, if they just have just some misalignments where they're tighter on one side, because there's such tightness in the muscles, the lymph nodes can't function, it can't drain as easily as well, where it drains the garbage. It's kind of the garbage disposal system of the body, and so that makes a big difference. As far as torticollis goes, we see a lot of babies with that as well. You know, where baby comes out, head and neck is turned like this, they may have been kinked like that in the womb, and we see a lot of tight musculature, and, you know, baby's head is just tilted. So we see babies like that all the time. We have some very good results with that as well.
Absolutely. So, you know, it's a very gentle, you know, basically like checking, imagine checking a tomato for ripeness. That's the amount of pressure. Maybe sometimes we just turn the head a bit, and then you just feel it slide in. You know, it's you know, the baby, like in the video, babies oftentimes fall asleep or they feel relief. You know, I get a lot of bowel movements after, and that's because the digestive tract's working better.
And they don't, with babies, we don't hear the big popping noises. People think, you know, especially
Yes.
when adults go and they say, wow, they feel big popping noises. It's like, you're going to do that to my kid? And it's going to sound like that? No, it's not going to look like that. It's not going to sound like that. It's very gentle, very easy on a baby.
That's the that's the big misconception is, oh, I can't imagine, you know, they automatically think you're going to be, you know, twisting or cracking, you know, bones. They have cartilage when they're born. You know, it's a bone is not ossified. It's cartilage, so it's very soft and it doesn't need much to be aligned.
Even with younger kids, 2, 3, 4 years old, the adjustment is very gentle, very easy. You know, sometimes you wouldn't even think they did too much. Sometimes, by then they'll start to have the audible sound, little clicking noises, but it's not the same as what you'd see in a 300-pound linebacker, as we're putting our full force in there and making adjustments on them. You know, like you said, they're not even ossified all the way. They're cartilage. When we look at an X-ray on a child, even their tailbone, it's 5 different little bones. It looks like a tail, which is why it's even called the tailbone.
Yes.
Yeah. Once they go through puberty, the bones start to ossify a lot more. So, you know, the adjustment will hear more sounds or look more rough, even though it doesn't feel rough, and it still feels gentle and easy to the patient.
Yes. So, you know, Dr. Desjardins, he founded sacro-occipital technique, which I use in my office. He says that all subluxation patterns of misalignment will happen in the first 7 years of birth. And yeah, I was thinking about that today, and I said, well, how can that be? You know, people have injuries after. Well, he's not saying so much that, you know, you're not going to get injuries and subluxations after that, but the pattern of how the spine develops.
Everybody compensates for it.
Okay, so the spine, during the developmental years, you know, the spine's growing, ossifying. You want to make sure, just like your teeth, you know, taking care of your teeth and cleaning them every day, and you know, if they do get cavities, getting them filled. The same thing with the spine. During those first years, those are the most critical because the spine is developing. You don't want scoliosis to set in, degeneration to start too early, and it you know, so they show that, you know, research shows that age doesn't always, you know, mean degeneration doesn't follow age.
And, you know, we love taking care of children and seeing results with some of the things like the ear infections and allergies and asthma and ADD, but more than that, we just like taking care of children just to keep a healthy spine, just for overall performance and keep it healthy. You know, sure, we like to see as chiropractors some great results with some symptoms, but more importantly, we just want to keep their spine healthy. Same thing with adults and athletes. You know, a lot of athletes get adjusted. Most professional athletes all get adjusted before or after their athletic competitions, just to keep their immune system, their nervous system, and their spine functioning properly while they play their sport.
Exactly. So, you know, the most important thing is getting the spine checked right away. Yes, you know, if you correct subluxation at the time of the injury, yeah, it can be corrected much quicker than if we let it go.
Absolutely. That's all the time we have for today. Thank you, Dr. Baltazar, for joining us.
Thank you.
Again, this has been Ask the Chiropractor. I'm Dr. Adam Rodnick out of Commerce Township, Michigan. And remember that God gave you the gift of life, and what you do with that life is your gift back to God. Thank you, and we'll see you next time on Ask the Chiropractor.